Chronic kidney disease is complex and there are many stages and causes, but the two giants, diabetes and hypertension, leads to the majority of cases. And given the role that lifestyle factors can play in these, it seems appropriate to focus this episode on what people who already have a diagnosis of chronic kidney disease can do when it comes to lifestyle changes to get the best life out of their kidneys.
So today we want to welcome our guest, Angeline Taylor, a dietitian who specialises in renal dietetics, and she's chair of the British Dietetics Association, Renal Nutrition Specialist Group, and a member of the UK Kidney Association Sustainability Committee. So welcome, Angeline. Thanks for coming on the podcast.
Thank you for having me. It's such a pleasure to be here.
Let's get straight to the point, shall we? What does diet pattern have to do with outcomes in chronic kidney disease?
You've hit the nail on the head almost with the fact that hypertension and diabetes are two of the leading causes, and we know that both of those respond well to dietary changes and lifestyle changes. But equally, and we're now seeing that obesity is also a leading cause of progression of kidney disease as well. And of course, that can be very much related to diet and lifestyle as well.
So how strong is the evidence in this area that you can get different outcomes for people's kidneys through diet?
It's interesting actually, because I've been looking at this and thinking about my journey and how I got to where I am, and in seeing how plant-based diets are used now as a treatment almost, or a lifestyle for people living with chronic kidney disease. I think I must have reached out to the Plant-Based Health Professionals founder probably 2017, something like that, after reading a few articles and just looking for resources for my patients and finding more and more evidence along the way to support the change. I've been on quite a journey, and I've been looking at that because we've actually, this year, we're going to the UK Kidney Association conference in June to talk about plant-based diets. And we have some wonderful speakers talking about the benefits of plant-based diets, in particular around the microbiome as well, and how that has an impact on chronic kidney disease. And the reason I think we're able to really talk about it this year is because it is now part and parcel of international guidelines. So the evidence has brought it to the forefront, if you like. Only in 2024, KDIGO, which write international guidelines for kidney disease, produced their CKD guidelines last year. They went out for draft in 2023, and then we had the final version in 2024. And in it advises people living with chronic kidney disease to adopt a healthy diet with a higher amount of plant proteins in comparison to animal proteins, with less ultra-processed foods. So isn't that wonderful that I've been on that journey, read all these articles, reached out to the plant-based health professionals for support over resources, created these resources, and now we're seeing them in international guidelines.
It's wonderful news. So you've told us exactly what's in that guideline. What were the studies that got them to that conclusion?
There's been some big population-based studies, so things like the Nurses' Health Study or the atherosclerosis study, the Chinese Health Study. So those sorts of ones where we've got large populations of people and where you can see higher intakes of red meat or processed meat. And in some studies, high intakes of sugar-sweetened beverages, so those ultra-processed, high sugar foods. And then you see a higher amount of CKD.
Just following on from that, we talk about CKD, and obviously it's something that people don't want to get in the first place. If they have got it, they don't want it to progress. And ideally, they would like it to reverse. But how much evidence do we have, if you've got CKD, that you can really do something to improve your kidneys through changing your diet?
Yeah, I think the evidence there is emerging quite strongly. The fact that it's now come through in the international guidelines, it really focuses on the improvements that you see in the cardiometabolic factors. So your diabetes, hypertension, cardiovascular disease, as well as obesity, all of which are factors in the progression of chronic kidney disease. But it does also mention quite specifically about the improvements or the benefits of plants with regards to the microbiome and what's going on there, as well as improvements in what we call net acid production. I'm not talking about stomach acid, and that's where patients sometimes get a little bit confused. I'm talking about acid in our blood, because if we think about the kidney's job, one of its jobs is to maintain the acid and alkaline, or the pH balance of our blood. We know that more vegetable-based foods or plant-based foods can help to alkalize our blood, whereas animal foods are more acid forming, and we get a higher amount of acid within the blood, which is a progression risk factor in itself for chronic kidney disease.
Right, absolutely. And of course, when it comes back to that acidification point, I've still got patients that are taking things like sodium bicarb when they've got quite advanced kidney disease. Some GPs, for example, might be familiar with that as a way of trying to manage that acid overload.
We call it metabolic acidosis. Yeah, we quite often prescribe sodium bicarbonate to manage that. But equally, we've seen that vegetables can have there's studies that show that vegetables can have an equal impact when it comes to alkalizing the blood.
Yeah. So coming back to what we do as GPs, and I thought it would be interesting if before speaking to you, I actually asked a couple of GP colleagues what sort of diet someone with a more advanced stage of kidney disease should be following. And to be honest, they didn't like this question. They did say they didn't really know. But when I pushed them, they said, well, obviously you've got to avoid salt. And then they started saying, well, don't eat too many bananas or tomatoes because you don't want to eat too much potassium. And then they said, well, you could cut down on protein. And perhaps the other thing that they remembered from their hospital days was things like having a fluid restriction. So actually saying to somebody, don't drink more than 1.2 litres a day. So what we're really interested to hear is if any of this advice that might be offered by our colleagues, does that actually help kidney patients? Or do you think there are any myths that need busting here?
There are a few myths that we might need to bust here. So if we start with that order, so if we talk about salt, for example, yes, that goes across the board regardless of what stage of kidney disease you are. It's definitely worth looking at lowering your salt, not to a no salt diet, because of course that's practically impossible, but trying to avoid adding salt if you can at the table, and really being mindful of the types of products that you're buying. We know that the majority of the salt in our diets comes from the salt that's already been added to food. So looking out for foods that have less salt in them. Now that does present its own challenges, because one of the things that has a very salty taste is potassium chloride. And many food products that are marketed as low salt or reduced salt have taken out the salt but replaced it with potassium chloride. So it does get a little bit tricky for some people to navigate the food aisles. Having said that, not every patient needs to restrict or lower potassium. So if we move on to potassium does not damage the kidneys. It's not damaging. In fact, it's quite a protective mineral because it helps to lower blood pressure. So some people may need to be careful with the amount of potassium in their diets, but many don't actually need to restrict potassium.
Right. Does that depend on the stage of chronic kidney disease that you have, or is it just something particular to particular patients?
It's just individual to individual patients. So it might be related to some medications that they're taking, just the way that their body metabolizes and deals with or is able to filter potassium. So it's very, very individual. So there's not a one size fits all, you need to lower your potassium diet.
Right. So your main tip then on say salt is to definitely not add it to food. And that's probably for the health of the general population as well, isn't it?
Yeah, definitely.
You may have to have a little look at packets to see how much added salt there is, but watch out if that's been substituted with this potassium chloride, salty taste.
If it's been substituted with potassium chloride, it will be included in the ingredients. So it's clearly written in the ingredients. It won't tell you, unfortunately, how much potassium chloride has been added, but it will have to state that there's potassium within that product. So you would quite often see those sorts of things added to, say, for example, condiments that are marketed as low salt, or sauces that are marketed as reduced or low salt, or things like stock cubes, ready meals. You might often have it there.
Yeah, that was great, because I was going to ask you about salt substitutes. Lots of people ask me about low salt.
Low salt, yeah. So you quite often, you'll find that potassium chloride is simply low salt. So you're sprinkling potassium all over your meal. So it's not always the best alternative. Although not every patient or person will need to restrict potassium, okay, so they could go and use low salt as a product and put that over their meal. But actually, isn't it better that they get used to tasting the actual food and flavouring the food with things like garlic and ginger, lemon and lime, and all the wonderful herbs and spices that are available to us? And that's what I would encourage, rather than using a salt alternative.
Sounds wonderful when you put it like that. What about those bananas and tomatoes that my colleagues are worried about?
So this is, again, where it gets a little bit more complicated. Bananas and tomatoes and potatoes are quite often, it's the advice that I almost have to undo sometimes. I find a lot of patients, it's not just tomatoes, bananas and potatoes, it's also white bread. People have been eating wholemeal or granary bread for years and years and have swapped to white bread because they've read online that it's low in potassium. The amount of potassium in foods and the potassium content of food tables isn't really a reflection of what is going on in the body. So it's about how much of the potassium are we actually absorbing from that food. And when we look at plant foods like bananas, tomatoes, potatoes, they contain fibre. That potassium is wrapped up in that fibre, if you like. It's bound to it. So we actually only absorb about 50 to 60% of potassium from plant foods, in comparison to sort of 90 to 100% of the potassium in the additives in things like potassium chloride that's added to a lot of processed foods that you'll find ready available in the supermarket. I think it's also worth saying that plant foods aren't the only source of potassium. So you'll see potassium in processed meats and red meat, crisps, fruit juices, coffee, lots of very daily staple foods that people are having regularly in their diets. Chocolate, for example, is another source. So where possible, we try and preserve the patient's ability to still have potatoes, tomatoes and bananas, and instead focus on lowering things like crisps and fruit juices or dried fruit. They're providing less nutrition, if you like, to the patients.
That's clear. So before we go back to some of the myths, I just wanted to ask you about another electrolyte, if you like, phosphate. Sometimes we see this idea that you need to be on a low phosphate diet. Is that a problem when it comes to the foods you're choosing?
So it's a really similar scenario to potassium. We would only recommend lowering phosphate if phosphate's elevated in the blood. Just like potassium, we only really need to be lowering potassium in the diet if it's elevated in blood results. If phosphate is elevated, then we would look to lower some dietary sources of phosphate. But again, phosphate is now a really common additive in lots of foods. So you'll see it in a lot of frozen foods, so frozen fish, frozen breaded chicken, frozen chips, potato waffles, packet pasta sauces. Coca-Cola, for example, it's made with phosphoric acid. It's another phosphate additive. And similar to potassium additives, phosphate additives are absorbed very easily by the body. So we're looking at around 90 to 100% of the phosphate within those foods that's absorbed by the body. Whereas you'll find phosphate in a lot of plant foods like whole grains, nuts and seeds, and beans, pulses and lentils. They're also very rich in phosphate, but they're bound to something called phytates, which I'm sure you're familiar with. We lack the enzyme to digest phytates. So the amount of phosphate that we absorb from those foods is a lot lower. And so if somebody does need to restrict their phosphate, we again focus on lowering those processed foods, those ones that will contain the additives, and encouraging more of the plant foods.
That sounds good. I'm going to ask you now about what we picked up there earlier from colleagues about protein. Other members of society may feel like they keep getting the message that they need to eat more protein. Is it going to be the opposite if you've got chronic kidney disease?
So it really depends on the individual. I know there are some papers and it is in the guidance that you could have a low protein or even a very low protein diet. We don't in the UK work with very low protein diets. So in order to have a very low protein diet, you need to supplement with amino acids. And we don't have license to use those here in the UK. So perhaps in the US, they would be using very low protein diets and supplementing with those amino acids. A low protein diet, which is the next step up, we could use that with somebody if they were really wanting to delay the need to start dialysis, if they were very motivated to do it and they had great support from a dietitian to ensure that they weren't losing muscle mass, so that we're not going into sarcopenia, so we're maintaining some muscle mass.
That sounds like a very difficult balance, because obviously if you've got chronic kidney disease or you're nearing dialysis, you've probably also got other illnesses or comorbidities going on. And the idea of not having enough protein does sound a bit risky to me, but yeah.
That's exactly it. Because if you think about starting dialysis it's a wonderful life-saving treatment, but it does take its toll on individuals. And if you go into it less nutritionally well, it's more likely that you'll suffer more fatigue, perhaps, that you may struggle more with your appetite. Being as nutritionally well as possible going into needing dialysis is important. Hence why we're really reluctant to go into that very low or low protein diet unless there's great support there.
Or worse, if you're waiting for a transplant and you're doing dialysis, then obviously you need to be in the best shape possible.
So if you're having dialysis, then the protein requirements go up quite a lot, because part and parcel of the dialysis process, although it's excellent at removing all those toxins that have built up in the blood, the side effect of it is it will also remove some protein as well. So a higher protein diet is needed for dialysis, those people having dialysis.
In general practice, Angeline, the majority of our patients with CKD, with chronic kidney disease, will be at the early stages, like stage 3, sort of nowhere near, dialysis yet. And does the protein question apply to them? I mean, I think, that's what the majority of patients will ask us in that sort of stage.
So at that stage, I wouldn't necessarily be looking at a low protein diet, and I certainly wouldn't look at a very low protein diet. I would look at what is classed as the general population's protein requirements, which is about 0.8, which is also what's documented in the KDIGO guidelines, those international guidelines that I mentioned. So about 0.8 grams of protein per kilogram of body weight for a generally well person. Now, it may be that somebody needs slightly more if they aren't well, or if they've got the chronic conditions that requires that. And the guidelines do allow you to go up to 1.3. It does suggest not going beyond 1.3 for those people that are at risk of progression. So it's taking into account what the individual needs, but also any potential risk for progression as well. It could be that their CKD is very stable, and actually having a little bit more protein is not a problem for them. If they're fit and well and they're exercising regularly and they might need that little bit more protein, or they're a little bit older. And of course, we know from as you get a little bit older, you might need slightly more protein as well. So actually, we're preserving their muscle mass as well. So yeah, we've got a little bit of movement between that 0.8 and 1.3. And certainly if there's no risk of progression and they're perfectly stable, why not go for that slightly higher end of the scale? You said that you certainly don't want to be having excessive amounts and a cooked breakfast every morning and a huge steak every night. That's excessive, and lots of protein snacks or protein lunches throughout the day. So, or protein drinks. There's certainly no need for all of that, but a normal protein intake is fine.
So you mentioned a steak there, and so that brings us to our next question, which is whether there are any differences that we can. Well, I think you already did conclude them when that we're recommending eating more plant-based overall, but whether we can make any specific conclusions about differences in eating animal versus plant proteins.
Yeah, so I think we sort of touched on it a little bit, didn't we, when we talked about the acid and the microbiome, but I didn't really go into detail about the microbiome. And there is a lot that's going on there that I think is worth talking about. And there's a wonderful paper that I would encourage people to read. So it's plant-based diets to manage the risks and complications of chronic kidney disease. And it's one of the first authors who I've seen speak, and he's fantastic, was Jan Carrero. It's got a wonderful diagram in it, and it shows the microbiome. And on one side, you've got red meat perhaps coming in to the gut. And because of the nature of having CKD, you've already got the endothelial barriers are sort of compromised. So there's gaps there, if you like. The fermentation of that red meat happens by a particular type of bacteria, a proteolytic bacteria. And the byproduct of that proteolytic bacteria is to produce what we call uremic toxins. And those uremic toxins can make their way through the barrier in the gut into the blood, upset the acid balance of the blood, but also you've got uremic toxins there as well. So you've got two things going on, if you like, and those uremic toxins have to be filtered out by the kidneys. So you're putting more stress on the kidneys from a uremic toxin point of view, but also because it's a more acidic environment, and your kidneys now have to buffer that with some bicarb and create a more alkaline environment. And on the flip side, if we look at something with some fiber, some plant foods, making its way into the gut, that gets fermented by a different type of bacteria, saccharolatic bacteria. And as we know, the fermentation process produces some fatty acids, which are beneficial for things like insulin sensitivity, lowering blood pressure, also tightening those junctions in the gut. So we have less leaky guts as well. So we're not leaking toxins into the blood or acid into the blood. So we get a more alkaline environment, but also improvements in things like insulin sensitivity and blood pressure control.
The last point then on tips that may or may not be useful for diet is about, drink more water, drink less water. What can you tell us about hydrating yourself if you've got kidney disease?
I mean, it is a really confusing area. And I think that the take-home message is everybody is individual here. So really seek advice on an individual level when it comes to fluid. There's certainly no need to start restricting fluid in the early stages of kidney disease and even in the late stages of kidney disease before needing dialysis, unless advised to by a nephrologist. Reasons why you might need to restrict with fluid before starting dialysis may be linked to things like heart failure, where we're less able to get rid of the fluid, or if we're trying to hold off from starting dialysis and fluid's the issue for people. Fluid isn't always the issue for people needing to start dialysis. So it's, again, very individual. Some people still pass plenty of urine even once they start dialysis, which means that restricting fluid isn't required because obviously what's going in, we need to make sure comes out. So the need to restrict with fluid is an individual assessment made by a medical professional, really, in terms of, is fluid building up in the body? Are we seeing signs of fluid overload in the body? If we're not, and people are still passing plenty of normal coloured urine, then there's no need to restrict fluid, but equally, there's no need to drink excessive amounts. My advice is always to listen to your thirst. If you if you're thirsty, then drink, and notice the colour of your urine. So you want that pale straw colour urine. And if that's happening, then you're probably nicely balanced from what's going in is coming out.
I think that's a really good reminder for healthcare professionals that they need to be passing straw-coloured urine, because so many people don't get to take enough breaks.
Very true. There does come a time for some people that they need to drink a lot less. And it's not just what they drink, it's the fluid that's also within food. So, for example, yogurts, ice creams, any milks, including plant milks, all of those things, they're the milks that you use to make up a porridge or add to a cereal or a soup, a vegetable soup, for example, that will still be fluid.
It all adds up.
Yeah, it all adds up. So it really depends on the individual. And quite often I have patients that are having dialysis, routine dialysis. They have that 3 times a week. And so they don't seem to have any residual kidney function remaining. And so they don't pass any urine at all. And therefore, what goes in, the only way to get it out is through the dialysis process. And so they do at that stage limit their fluid intake to around 1 litre a day, which can be really hard. It's really difficult. That's where things like salt comes in. Salt education comes in really useful, because the more salt you have, the more thirsty you're going to be.
That's fascinating, Angeline. Can I take us back a step to the CKD stage 3, the sort of typical patient that I would see in general practice who perhaps doesn't get anywhere near a renal dietitian yet, because like you say, they're pretty stable, but they will ask me, what should I eat, doctor, or what should I avoid? And can I go back a second to the plant versus animal protein that we discussed earlier? Would there be merit in saying, actually, you know what, if you was to switch to plant-based protein 100%, that would also protect your kidney function for the future?
Yes, potentially. I think obviously it depends on the cause of their CKD. Okay. So if it's one of those cardiometabolic causes, then there's the potential that would delay the progression. And that's what's written into the international guidelines now. That's what we see. We could delay the progression of their CKD, potentially halt it where it is, and have a very stable kidney function that will last them the rest of their days. Equally, if it depends what their starting point is as well. If they're not quite ready to do a completely whole food plant-based diet, can you meet them halfway? Can they think about a plant-based lunch every day and still allow them to have their animal protein? Is that an improvement on where they are right now? So it's not an all or nothing approach, but there's definite benefits there to moving them away from a high animal-based diet or one that's high in those ultra-processed foods to something that's more plant-based. Introducing more vegetables with their main meal, for example, can be hugely helpful in just lowering the acid load from the meat that they're having with their meal, which is such a lovely place to be, because traditional renal diet, if we go back years ago, was very restrictive on fruits and vegetables, and it always felt really disheartening talking to patients about restricting fruits and vegetables. So it's a lovely place to be now, where we're really encouraging more of those nutritious foods, because it's about not just looking after your kidneys. Otherwise, we're not seeing the whole person. It's about looking after your heart and your brain and your gut. So it goes beyond just the kidneys.
Absolutely. Yeah. No, that's a brilliant sort of summary, because I think as a GP, I wouldn't have really thought about what sort of things to speak to patients about CKD and diet. So I think it's really fascinating to hear all these. And would you have any particular tips on what patients should include in their diet? I was reading something about nuts being quite beneficial. Is there any evidence for specific foods like that?
I would always say look at the whole diet rather than adding in specific foods just because you think that they're going to be beneficial for your kidneys. It's about looking at the whole diet. I mean, you certainly couldn't go wrong by adding in more vegetables, for sure. If you can add in more vegetables, that's fantastic. A handful of nuts, plain unsalted nuts, I certainly encourage those. They used to be restricted. People were told to avoid them completely, whereas I very much encourage them. Again, it comes back to the fact that they They contain fibre. That fibre prevents people from absorbing the phosphate and the potassium that our patients worry about. I think what we have to be careful with is portion size. So when we say about including a specific food in the diet because it's kidney friendly or whatever term people want to use, we have to be careful about people going away and thinking, well, I've heard almonds are good, so I'll eat a bag of almonds, whereas actually a portion is really about 30 grams, 2 tablespoons of nuts a day. And that's where the evidence lies as well, isn't it, for things like lowering lipids in the blood, which of course by doing that we are also looking after our kidneys and our heart.
Definitely very easy to overeat nuts in my house, that's for sure. What would be your advice on supplements? So generally in the UK as GPs, we recommend vitamin D to most of our patients, particularly in the winter months. As plant-based health professionals, we recommend B12 to our plant-based cohorts. Would there be anything specific for people with CKD beyond that?
No, not really. I think vitamin D is something that we quite often give our patients, certainly towards the later stages, just because the kidneys are involved with the activation of vitamin D. So we get, as you know, we get it from sunlight. It has to be activated in the liver and the kidneys. And some of our patients are deficient in vitamin D. So it's not uncommon for us to recommend vitamin D for our patients. I mean, if we're looking at earlier stages, like the stage 3 that you're at, I certainly think vitamin D, following the guidance of the general population, which is October to April, the winter months, having some vitamin D, that's not a problem at all. I would certainly encourage that. And if somebody's following a completely whole food plant-based diet, then a B12 would be really sensible, wouldn't it? Just like the general population. And it's a vitamin that we monitor in the later stages as well of CKD, and certainly anybody that's having dialysis, we would look at their B12 levels. We quite often even supplement the B vitamins and vitamin C when people are having dialysis, because the process of dialysis can remove those water-soluble vitamins.
Of course. Mm-hmm. Last point, I suppose, on specifics with regards food. Is there anything in particular that you would ask patients to be cautious about or avoid? Again, I don't know where I've read this. I'm starting to wonder where my questions have come from about star fruit.
No, that's true. Yes, that is true. We do. I mean, you don't really see that typically in the usual diet, do you?
It's not on the list, no, the shopping list.
No, we do suggest avoiding star fruit because it's got a toxin that can cause damage to the kidneys.
Interesting.
There is also, for people with a kidney transplant, a lot of food safety recommendations. So obviously people who have a transplant take medication to prevent the rejection, and that can lower the immune system. So they're essentially immunocompromised. And so would need to avoid certain foods. So things like fermented foods, not because there's evidence that they're going to be a problem. There's a lack of evidence that they're okay. That's the thing. And so we sit on the side of caution. If we're looking at plant-based foods, generally they're safe, aren't they? They don't present much of an issue from a foodborne illness point of view, with an exception probably of rice, which, if it's cooked and cooled properly, isn't an issue. There are a few other additions if somebody's taking transplant anti-rejection medications, things like grapefruit and pomelo. Those particular ones, they can cause toxic buildup of the immunosuppression medication in the body, because they prevent the enzyme that breaks the medication down, so the medication sits in the body rather than being filtered out.
It's interesting what you were saying about the immune system and transplant patients. When I was looking at the dietary guidance for people who'd had a kidney transplant, it was different hospitals, but there was a leaflet from Plymouth that really put a lot of emphasis on avoiding takeaways at least in the first 6 weeks of having a transplant. It did get me thinking. I know you mentioned they've got a thing about fermented foods and the potential risk there, but it did get me thinking, given that food poisoning is far more likely to come from animal products, should we be giving better advice to transplant patients about the benefits of a plant-based diet?
Oh, it's so wonderful that you found that leaflet and that you asked that question. So that leaflet was produced by myself in collaboration with Plymouth and with Bristol.
I did not know that.
So I'm based in Exeter, and Bristol and Plymouth are our transplant units. So our patients, they have their transplants either in Bristol or in Plymouth and then come back to Exeter. So I wrote that information many years ago now for Plymouth, Bristol and Exeter so that we were all saying the same thing, because there's variations across the country. And that information is based on something called a transplant toolkit, which has been produced by the Renal Nutrition Group, which is the group that I chair. We recently changed our name, incidentally, to the Kidney Dietitian Specialist Group. We are in the process of reviewing that particular toolkit for transplant advice. And I've written a section within it about more plant-based foods.
I was just wondering whether it was sort of, I can see actually that it might have been written by a plant-based dietitian, because it's almost like going plant-based by stealth. Once you've had 6 weeks off your takeaways, you're not going to go back to the fried chicken and the Domino's salami pizza, are you? Perhaps.
So, not always, but hopefully. Yeah.
Right, that's the plan. Is it possible for us to just summarise so that we can remember it as GPs, or if there are any GPs or healthcare assistants or anybody listening that might be talking to patients about their diet? Are you able to summarise why a plant-based diet can be beneficial in CKD?
The benefits of plant-based diets in CKD, I think, extend beyond just the cardiometabolic improvements that you might see in cardiovascular disease, hypertension, diabetes. It's also looking at the fact that there's improvements and protection at the microbiome level and improvements in the acid-alkaline balance within the blood, which both help take the pressure off the kidneys, but equally help to manage the complications of kidney disease that we see. So, for example, those potassium and phosphate issues. So it's a win-win, if you like. You're not only slowing down the progression of the kidney disease, you're helping to manage those complications of kidney disease as well.
As you said earlier, if you manage the other conditions like the diabetes, hypertension, where we've also got really good evidence for a plant-based diet, you're going to help manage the kidney stuff by default, aren't you?
Absolutely. And I suppose what I haven't mentioned as well, and it's so common, and I'm sure you're seeing it daily, is that obesity as well, isn't it? And the fact that the obesity is often linked to hypertension and diabetes, but also that the obesity has its own separate risk factor, if you like, for kidney disease, because we see things like hyperfiltration of the kidneys, more pressure on the kidneys, damage to the cells, the filtering cells of the kidneys as well. The cardiometabolic benefits extend beyond just hypertension and diabetes. It's the obesity as well.
It's lovely to see that actually the evidence is now starting to transition into the guidelines that you mentioned. But are there any areas that you would have or you hope to see more research into that you feel we're lacking?
Yeah, so I think the area that I'd like to see more research is with our dialysis population. There's that concern, I think, and apprehension from a lot of dietitians about implementing plant-based diets because of the risk of muscle loss during dialysis, because the loss of protein during dialysis, so you need a slightly higher protein diet. Now, I think one of the things that has been hypothesized is that by eating a plant-based diet, you see less inflammation and therefore maybe need less protein to eliminate the protein losses. Maybe for those patients that eat a plant-based diet, their protein requirements might actually be slightly lower. We don't know that yet. And I think that would give us as dietitians working with patients having dialysis the confidence to implement more plant-based diets with patients during their dialysis journey.
Brilliant. And I know you're very busy, but is that something that you've got capacity to do?
I'm aware that there is work underway looking at protein requirements in dialysis, because the protein requirements in dialysis that we work to at the moment is based on quite old research. Dialysis machines and dialysis processes have moved on quite a lot. There's been lots of advances in technology. So perhaps we're not seeing as much protein loss in our patients. I think that's what we need to look at.
Interesting. We look forward to seeing more about that.
Yeah, so Kidney Research UK have funded previous chair of the Kidney Nutrition Group, and he's gone on to do his PhD, and he's looking at this.
Wow.
And is a big advocate of plant-based diets.
Oh, amazing.
Yeah.
That's brilliant. And so for our listeners who want to know a bit more, perhaps they don't get to see a renal dietitian, or, perhaps the ones like my patients who are in general practice and thankfully perhaps don't need to see a renal specialist, what resources could we point our patients or our colleagues towards to get more information about all this?
So there are 3 fact sheets on the Plant-Based Health Professionals website. One for CKD, a general CKD one for people having dialysis, and one for transplant recipients. So that really talks about the considerations of a plant-based diet at each stage, and what to focus on including in the diet, and perhaps what to eat less of in the diet. So those fact sheets, as you know, are all freely available on the Plant-Based Health Professionals website. For people eating a plant-based diet that are struggling with their potassium and have looked up online about restricting all these lovely plant-based foods, please go to the Plant-Based Health Professionals website again, because we've produced a leaflet, downloadable leaflet, for vegan, vegetarian and plant-based diets that need to lower potassium. And it's got a 6-step process that you can go through in terms of lowering potassium. And then for general healthy eating advice, we have created, when I say we, the Kidney Dietitian Specialist Group that I chair, we've created a booklet, and it's just simply healthy eating. And it really focuses on increasing those plant foods and reducing the animal foods, and reducing things like salt and some of these additives. It talks a little bit about the additives. So that particular leaflet, if people have access to that, is accessible on Patient Knows Best. There's an English version, and then we have translated that into 7 different languages.
I just have one final question. In the introduction, we said about your role in the UK Kidney Association Sustainability Committee. I just wanted to know more about how we came to have this particular committee, because is it just because all healthcare specialisms should consider sustainability, or are there specific considerations for kidney patients?
I have to be honest and say I don't know why it was founded, because I wasn't there when it was founded, but I think it's fantastic that the UK Kidney Association are thinking about sustainability. We are quite an energy intensive treatment, certainly when it comes to dialysis. It's quite a carbon producing process. Even just getting people to dialysis, we provide transport, or people drive to dialysis 3 times a week, sometimes quite a distance as well. The consumables that are used in dialysis are quite plastic heavy. We use acid and a lot of plastic bottles, and many of which may be thrown away at the end of dialysis. So green nephrology, I think the UK Kidney Association have been leading the way, and they've done a 12 steps to green nephrology. If anybody is interested in green nephrology, on the UK Kidney Association's website, there's the 12 steps that can be accessed through that website.
Do they think about food at all?
They have, since I've joined. Yes, they've been fantastic at embracing and allowing me to educate my colleagues. And I was really fortunate to go to the Dialysis Society conference last year and present on plant-based diets in CKD, and allowing me to promote the fact sheets that we've created through the Plant-Based Health Professionals. And the Sustainability Group want to work with the Kidney Dietitian Group in the future to see how we can collaborate as well. And I know that we've got Greener by Default, Amy, coming to speak to the committee, the Sustainability Committee, just talking about the Plants First Healthcare initiative and the work that they do at Greener by Default and how they can support trusts in adopting a plant-based menu.
Wonderful, getting that message out there.
And if people want to connect with you, if people are interested in the work that you're doing, I know you're on LinkedIn, is that right?
I am, yes, I am on LinkedIn.
Is that the best way?
I think
connect?
It probably is, yeah, probably is the best way. I am also on Twitter, and we have the Kidney Dietitian Specialist Group on Twitter and on Instagram as well, so you can connect that way too.
Great. We hope there's more kidney dietitians listening who will reach out to you. Thank you. And before we let you go, though, we can't not ask you what you're having for your dinner tonight. What does a plant-based renal dietitian eat for dinner?
So it's Friday and the end of a long week. So Friday night, quite often, but not always, is pizza night in our house. We make our own dough. So my husband and I bought an amazing bread maker before we had children. So this is like 17 years ago, and it's still going now. And it makes we've played around with the dough recipe and reduced the salt, reduced the sugar. We use like sort of half wholemeal, half white flour. And the children seem to accept that. They're quite willing to go for that. And then obviously you can create your own toppings. And I do have pineapple on my pizza.
Oh, that's
special. Yes. With peppers, sweet corn, mushrooms. Yeah.
Not very Italian.
We were talking about this with Michael the other week, weren't we? Not for his Italian friend. Sounds good though. And lots of veggies, did you say?
Lots of veggies. So yeah, normally some sweet corn, chopped peppers, mushrooms, obviously tomato we base. Yeah. And you don't need to have cheese to enjoy pizza.
Yeah. Although, can I say I have found a new recipe for vegan cheese that I'm going to use in my dinner tonight, and I would recommend it if you have time to make it for your pizza. It's from that Viva book, Claire, that we both got, the Viva cookbook, and it's essentially a equivalent of one big carrot and a potato boiled until it's cooked, and then blended, drained and blended with 4 or 5 heaped tablespoons of nutritional yeast, maybe a little bit of miso if you can have a bit of salt, and I think that was it actually, maybe a bit of lemon juice. That makes a really nice cheese sauce.
It does look like mozzarella or something, doesn't it? It's really like
it's incredible.
Yeah.
That sounds amazing. And you can put it on a pizza, do you think?
I've never put on a pizza, so tonight I'm going to put it in a quesadilla with black beans, with smashed black beans, and it works quite well in that. So, but I will report back. I'll try it on a pizza and let you know. I think in their book they use it for like a mac and cheese, don't they, with macaroni?
Yeah, I think I noticed that if you blend, is it swede or turnip, it really does do this sticky, kind of stretchy, cheesy sauce. So I think you could even add that in there if you wanted to.
Nice. What about you, Claire? What are you having for dinner?
Well, I think I've just about got everything I need to do a butternut squash risotto. And I love doing this because I get to crack open a can of wine so that I don't end up, getting tempted to drink. You can just open a can of wine. It's a good tip if you're not a drinker. You can just open a can of wine and use that for cooking to do your risotto sauce. It's roasted butternut squash and roasted sage leaves and pine nuts and a few other bits and pieces in there, your usual, garlic, onion, and it makes a really nice risotto, creamy risotto.
Lovely. I love sage. That's really nice.
Sage just works so well, doesn't it, with butternut squash? I wondered if I could just mention another thing that I work on and where you can find out more about. So, I work for quite often for Kidney Care UK, which is a national charity, and I work on a project of theirs called Kidney Kitchen. We produce recipes. So they're all analysed and we put them through our committee to approve them. And once a month, we film them, and we have a food photographer and a food stylist, and they go up onto our website, and there's about 200 recipes on our website now.
Oh, amazing.
And we have also produced 4 magazines. So we've produced one called Eat Well, Spend Less, and that was in response to the cost of living crisis. Then we produced one called Safe Weight Loss as well. And it was safe because the recipes are basically just based around lots of healthy eating, but they're calorie counted, and they're all, if people need to lose weight, for example, in order to get on a transplant list, but they're struggling with potassium or phosphate, then these are safe recipes that will help them lose weight, but be able to have plenty of fruits and vegetables as well.
Do you get to exclusively showcase plant-based eating with those recipes?
It's not exclusively plant-based, no, but we want to show how much fibre is in foods, and we want to show how many portions of fruits and vegetables are in meals, and we aim to always have fruits and vegetables within each meal. We have a good mix of healthy plant-based foods as well as foods that do contain animal foods but are what I would describe as a healthy dish, as in like a stir fry with some whole grain rice. We use vegetables within each dish, so they're not exclusively plant-based. That resource is free to patients, and the magazines that we've produced are also free. So people can go to Kidney Kitchen and order those magazines, and they'll go to their house for free. We try and have sort of a good mix of vegan, vegetarian and meat-based meals so that it meets the needs of everybody. But then hopefully people who would traditionally eat more animal foods would think about trying some of the vegan or vegetarian recipes within the magazine as well. And it just takes away from that processed food. We're trying to get people to cook at home.
Yeah.
With
And
less,
eat real foods. Yeah.
eating real whole foods. Exactly.
Absolutely.
Yeah.
Oh, Angeline, I feel like I've learned so much. It's one of those episodes that me and Claire often say we need to go back and listen to sort of, take everything you've told us. So thank you. Really appreciate your time and your expertise and spending time with us today. It's been a really wonderful chat. So thank you again.
Thank you for having me.